Quebec is thinking about redistributing more than 1 million family doctor appointments to patients who don't have a doctor. A new report by Quebec Health Institute recommends healthy people with family doctors. They're recommending giving those appointments to the most vulnerable populations. In 2022 to 2023, 1 in 4 people were not registered with a family doctor. That works out to 2.1 million people. For more on how this might work, let's bring in Dr. Laura Sang, a family physician in Montreal. Good morning, doctor.
Good morning.
So how would the province determine who is most vulnerable?
So patients are assigned vulnerability codes when they're registered with a family doctor. Codes can be applied for things like mental health problems, diabetes, cancer, etc. So I wonder if the government would start going through some of those codes to identify people who are more vulnerable and prioritize them, and people who don't have any vulnerability codes, who haven't consulted. I'm wondering if they would be most likely a target for this plan if they were trying to implement it. But I have no idea exactly how they're going about it. It still seems like it's in the, brainstorming phases. But that would be my guess if they were going to try to, make this happen.
So let's talk about the flip side. So patients who are considered healthy, what risk could this create for them if they lose those appointments with doctors?
So family doctors are so important for getting to know, a person, not only the way they are now, but with their background, their family, their history, what risk factors they might have. And being able to follow that person over time gives you that context that is unparalleled by other means of care like walk-in clinics or more fragmented sorts of care. I worry that younger people, as they age, if they're not being followed by a family doctor, we're going to miss diseases that are going to be starting. We're going to miss hypertension, which is often symptomatic, diabetes, etc. They're not maybe going to get the prenatal care and counseling that they need if they're deciding to get pregnant. And similarly for doctors, I worry that if we're not seeing a variety of patients, that we're going to lose some of the skills that we have. For example, I know for me, I inherited a sort of older practice, and it's rare that I see patients of menstruating age. And while I was trained to be able to put in IUDs, I just haven't seen it frequently enough to feel comfortable doing it anymore. And that's a skill that I've lost because of the practice that I have. So I also worry about physicians out there not forming these links, being de-skilled for certain things. And, we always know that the earlier you can catch and treat a disease, the better off the person's going to be. So if you're only catching diseases later on in the process where there's more morbidity incurred and increased risk of mortality, I worry about, on a population level, how this will affect the health in 10, 20, 30 years if they were to go forward with this.
Absolutely. And we know that family doctors are already dealing with burnout, administrative backlogs. What would this mean for your practice?
So for me personally, I have a 500-something patient practice, and I am pushing myself to get to 200, sometimes 250 appointment spots per month. And it's still not enough. My patients are consulting colleagues, they're consulting in the private system, they're going to the ER. When you have a very sick population, they need that care very, very frequently. And there's so many forms that need to be filled out, whether it be for driver's license, handicap parking, etc. It just creates a huge administrative and psychological burden, especially for patients that have low, social support, and that you're sort of their only resource, making sure that they're safe at home. It can be very taxing, and especially for physicians that are towards the end of their career, that are on the brink of retirement, that are struggling to maintain the same patient load as they were previously able to. I worry that it might push them into an early retirement, or to go to the private system, or to leave the province altogether. And that would just lead to an even greater physician shortage than what we already have.
And you've also raised concerns that this may violate the Canada Health Act when it comes to accessibility, discrimination. Can you explain that a little bit?
So the Canada Health Act is based on 5 different pillars that are supposed to apply across all provinces. And for me, it was really the one that's related to accessibility, which means you're supposed to have, the same access to care regardless of age, health status, ethnicity, etc. So I wonder, by prioritizing care like that and only giving more vulnerable people access to a regular family doctor, how that would work within the framework that's been established for the Canada Health Act. Is this a violation? Again, I'm not sure. I can only speculate, but I feel like I understand where they're coming from, that there are so many people who are in desperate need of care and in need of a family doctor. But I do think that there are other ways to go about it other than removing people who already have a family doctor and breaking those bonds that have already been formed.
Dr. Laura Sang, thanks for your time this morning. We really appreciate it.
Thank you.
If you liked that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.